Let me ask you something personal, and I want you to be honest with yourself because this might be the most important health conversation you've had in a long time. Have you ever gone to the bathroom, sat down, felt absolutely certain something needed to happen, and then waited and waited, and nothing came? Not because your body was empty, no. You could feel the heaviness, the pressure, that uncomfortable fullness that told you something was definitely there. But no matter what you tried, nothing moved. If that experience sounds familiar, maybe from last week, maybe right now, I need you to stay with me for the next 20 minutes. Because what you went through has a name, and more importantly, it has a solution. Millions of adults over the age of 60 experience something called fecal impaction, a condition where hardened stool becomes so tightly packed in the lower bowel that the body simply cannot push it out on its own. And here is the part that worries me most as a doctor. The majority of people who experience this try to handle it the wrong way. They push harder. They grab whatever laxative is under the sink. They tell themselves it will pass on its own and wait. Every single one of those responses can make the situation significantly worse. Today, I am going to walk you through 5 specific, safe, and practical steps, counting down from number 5 to the most critical step of all at number 1, that are designed for adults over 60 who are dealing with this right now. Each step builds on the one before it. Each one is grounded in real clinical experience. And together they give your body the best possible chance of resolving this safely, at home, without panic, and without unnecessary suffering. My name is Dr. Emily Carter. The first 19 V's spent 10 years working directly with older adults in clinical practice, and I've seen firsthand how something like a bowel blockage can become genuinely frightening when you don't know what steps to take. This channel exists because too many important health conversations get cut short in the doctor's office. We don't have enough time. You leave with more questions than answers. And when something goes wrong at home, especially something as uncomfortable and private as this, you're left searching the internet at midnight, hoping someone will just tell you what to do. That's what I'm here for. Before we begin, I want to ask, have you personally dealt with this before? That feeling of being completely stuck with no relief in sight? Drop a comment right now. You don't have to give any details. Just let me know you've been there. Because I promise you, you are not alone in this. And you are not going to be alone in figuring it out. Let's start with step number 5. Step 5, stop straining immediately and change your body position before you try anything else. I know this feels counterintuitive. When something won't come out, the natural instinct is to push harder. But I want you to understand, when stool has genuinely hardened and become impacted, forceful straining does not help. It cannot help. The mechanical force your abdominal muscles can generate is simply not enough to move a compacted mass. What straining does do in that situation is create risk. For adults over 60, especially those managing blood pressure concerns or any cardiovascular condition, that sustained intense bearing down dramatically spikes pressure inside the chest and abdomen. It puts stress on the heart, it strains the pelvic floor. It can worsen existing hemorrhoids or even contribute to rectal tissue pushing outward, a condition called rectal prolapse. The moment you realize nothing is moving after a reasonable effort, stop. Stand up. Take 2 or 3 minutes to walk slowly around the room. Even gentle movement helps reactivate the natural wave-like contractions your intestines use to move things along, contractions that sitting rigidly on the toilet actually suppresses. When you come back to the toilet, change the way you're sitting. Place your feet on something elevated, a small footstool, a stack of thick books, anything stable that raises your knees above the level of your hips. This changes the angle of your pelvis. It relaxes a muscle called the puborectalis, the internal sling that keeps the rectal canal at a natural curve during regular seated posture. When that muscle releases, the passage straightens and opens. Lean forward gently with your elbows resting on your thighs. Breathe slowly in through the nose, out through the mouth. Use controlled, gentle downward pressure, not a hard push. The goal right now is not to force anything. It is to create the physical conditions where movement becomes possible. For some people, especially in early or partial impaction, this position change alone produces noticeable relief. One important note, if you are experiencing sharp pain, not just discomfort, but sharp stabbing pain, During any attempt, stop immediately. That kind of pain can indicate a fissure or a hemorrhoid that needs direct attention. Don't push through it. Call your doctor. Step 4. Use a gentle, appropriately chosen enema to soften the hardened stool directly. I know the word enema makes some people immediately tense up. Many older adults have a memory of the high-volume, uncomfortable hospital versions from years ago, and the experience wasn't pleasant. But what I'm describing here is completely different. A small volume, over-the-counter option specifically designed for situations like this, and when used correctly, it is one of the most effective tools available to you at home. Let me explain your two best options. Option 1. Mineral oil enema. Mineral oil works as a lubricant, not a stimulant. It coats the hardened stool from the outside, softens the surface layer, and reduces friction between the stool and the rectal wall. Because it does not trigger strong intestinal contractions the way stimulant laxatives do, it is much gentler on your system overall, particularly important for anyone managing heart or blood pressure conditions. Single-use mineral oil enemas are sold at most pharmacies without a prescription. Option 2. Warm water enema. A small amount of warm water, not hot, just comfortably warm, introduced gently into the rectum can hydrate and begin to soften compacted stool. The warmth also helps relax the rectal muscles, which often tighten and spasm around a blockage, making things worse. Critical warning before you reach for anything on the pharmacy shelf. The most common variety you'll see, sodium phosphate enemas, carry a specific risk for older adults. Sodium phosphate gets absorbed into the bloodstream. In people with kidney conditions, heart failure, or high blood pressure, this can trigger dangerous shifts in electrolyte levels. If any of those conditions apply to you, do not use a sodium phosphate enema without speaking to your doctor or pharmacist first. Mineral oil or warm water are your safer alternatives. How to use it correctly. Lie down on your left side. Draw your knees gently up toward your chest. This position follows the natural curve of the lower bowel and allows the solution to reach the impacted area much more effectively than standing or sitting would. Follow the product instructions exactly. Once you've administered it, remain lying on your side for the time recommended, usually several minutes. Do not immediately rush to the toilet. Give the solution time to do its work. If you've waited 30 to 45 minutes and nothing has happened, do not simply repeat the enema 2 or 3 more times. That is the point where home treatment has reached its reasonable limit, and the next right step is to contact a healthcare provider. More on that at number 2. We are halfway through, and I hope these steps are beginning to give you a clear, calm picture of what to actually do when this happens. If this video is helping you today, I'd love for you to type the word relief in the comments right now. It tells me this information is getting to the people who truly need it, and it helps me understand which health topics to focus on next. Every comment genuinely matters to me. Thank you. Now, step number 3. This one costs nothing, requires nothing from the pharmacy, and takes less than 5 minutes. Step 3. Perform a gentle abdominal massage to stimulate your bowel's own movement. This technique is widely used in clinical and physical therapy settings, and most people have never heard of it. It requires absolutely no equipment, no medication, and no special training. You can do it right now, at home, in about 4 minutes. Here's the concept. Your large intestine follows a specific path through your abdomen. It begins at the lower right side of your belly, travels upward along the right, sweeps across the middle beneath your rib cage, then moves downward along the left side into the lower left pelvis where it ends at the rectum. By applying gentle external pressure along that path, in the direction stool naturally travels, you stimulate the muscular wall of the colon to contract. Not forcefully, naturally, the way it's supposed to. Here's exactly how to do it. Lie flat on your back on a firm, comfortable surface. Bend your knees slightly. This relaxes your abdominal muscles and makes the massage more effective. Using the flat pads of your fingertips, not your knuckles, not your palm, begin at your lower right abdomen. Apply steady, gentle circular pressure. Move slowly upward along the right side of your belly. When you reach your rib cage, sweep across to the left. Then move slowly downward along the left side toward your lower left pelvis. Repeat this path 3 to 5 times. Use consistent, firm, but never painful pressure. The entire process takes 3 to 5 minutes. Many patients who try this for the first time describe feeling something they hadn't felt in days, the first genuine urge to go. Before you try this, please note these exceptions. Do not perform abdominal massage if you have a known abdominal hernia. If you've had abdominal or pelvic surgery within the past several months, if you have inflammatory bowel disease, or if you are experiencing sharp, localized pain anywhere in your abdomen. In any of those situations, contact your doctor before trying this. After completing the massage, lie still for 1 minute. Then slowly move to the toilet, using the elevated foot position we covered in step 5. Breathe steadily. Allow your body time to respond. These 3 steps, repositioning, enema, and abdominal massage, are most powerful when used together as a sequence. Each one builds on the last and creates progressively better conditions for your body to do what it needs to do. Step 2. Recognize the exact moment home treatment must stop and act on it immediately. This step doesn't require any product or technique. It requires judgment. And for many people, it is the hardest step of all, because it means accepting that what you're dealing with is beyond what you can safely manage at home. If you have not had a bowel movement in 3 or more days, and the steps above have not produced any meaningful relief within a few hours of careful effort, call your doctor's office or an urgent care clinic. Today, not tomorrow, not after one more attempt. Time genuinely works against you with fecal impaction. As the longer stool remains in the rectum without passing, the more moisture your body absorbs from it. It becomes harder, more compacted, and more difficult to clear with each passing hour. Go to urgent care or an emergency room immediately, not tomorrow, if you experience any of the following: abdominal or rectal pain that is worsening rather than staying the same, vomiting alongside the inability to pass stool, any blood appearing with stool or leakage, feeling faint, developing a fever, or feeling suddenly unwell in a new or alarming way. These symptoms can indicate that the impaction is pressing on surrounding structures, or that a separate condition is present that requires direct medical examination. When you speak to a provider, be specific. Tell them exactly how many days it has been. Describe any liquid leakage, which many people don't realize is actually softer stool from higher up seeping around a hardened lower blockage, not diarrhea. Bring or recite the full list of every medication you take, including supplements, antacids, pain relievers, and sleep aids, because several common medications slow bowel function significantly. At the clinic, your provider can perform a physical examination to determine exactly where the blockage is and how severe it has become. If it's within reach, they can safely break it apart manually, a procedure that may sound daunting but is far faster and far safer than continued suffering or guessing at home treatments. Home care is appropriate and effective for early impaction, but it has a clear boundary. Knowing where that boundary is and respecting it without shame, without embarrassment, is what keeps a manageable situation from becoming a true emergency. And now, step number 1. The step that most people only think about after the next crisis hits. It shouldn't be. Here is the pattern I see constantly in practice. The impaction finally clears. The relief is immediate and enormous. And within 24 hours, the person is back to exactly the same habits that created the problem in the first place. Within days, sometimes sooner, the cycle begins again. Step number 1 is everything you need to do in the first 24 hours after the stool passes, because that window is both your most vulnerable moment and your greatest opportunity. First, drink water. Immediately. Your rectum and lower colon have been under significant stress. The tissue is irritated and depleted of moisture from extended contact with hardened material. Begin rehydrating right away. Aim for 6 to 8 glasses of plain water spread throughout the day, not all at once, but consistently. Second, start a gentle soluble fiber supplement that same day. Psyllium husk, found in products like Metamucil, is one of the most well-researched options for keeping stool soft, bulky, and easy to move. It absorbs water and forms a soft gel that travels through the colon without hardening. The critical rule: always take it with a full glass of water. Fiber without adequate hydration can actually make constipation worse, not better. Third, review your medications. Write down everything you take, every prescription, Every over-the-counter tablet, every supplement. Bring that list to your next appointment and ask directly. I recently had a fecal impaction. Could any of my medications have contributed to it? Many commonly used medications, certain pain relievers, iron supplements, antacids containing calcium or aluminum, some blood pressure drugs, and sleep aids can significantly slow bowel motility. A doctor can often adjust doses, suggest alternatives, or add a gentle daily stool softener to your routine without disrupting your other treatments. Fourth, establish a consistent bathroom routine beginning tomorrow morning. 15 to 20 minutes after breakfast, your body experiences what's known as the gastrocolic reflex, a natural wave of muscular activity that moves through the colon in response to eating. This is the ideal window to give your body the opportunity to go. Set aside unhurried time. Use your footstool. Breathe slowly. No rushing, no pressure. Simply showing up consistently at that time every morning trains your digestive system to respond predictably. It costs nothing. It requires nothing. And done daily, over the weeks ahead, it is one of the most powerful recurrence prevention habits you can build. The 24 hours after an impaction clears are not the finish line. They are the starting point of the routine that keeps it from happening again. You now know to stop straining and reposition the moment nothing is moving. You know how to choose the right enema for your age and health history. You know the abdominal massage technique that encourages your bowel to engage on its own. You know exactly when home treatment must stop and professional care must begin. And you know what to do in those critical first 24 hours after relief to prevent this from happening again. Fecal impaction is not something to be ashamed of. It is a medical condition that affects millions of older adults, and it is overwhelmingly manageable when you know what to do and you act on it promptly. The people who end up in the emergency room with this condition are almost always people who waited too long, tried the wrong remedies, or simply didn't have the information they needed. Now you have it. Your digestive health touches everything: your energy levels, your sleep, your appetite, your comfort in your own body each and every day. Taking it seriously is not an overreaction. It is exactly the kind of self-care that keeps you feeling strong, staying independent, and living life on your own terms. If this video helped you today, please share it with a spouse, a sibling, a close friend who's been quietly struggling and doesn't know what to do. Sometimes the most meaningful thing we can do for the people we care about is put the right information in front of them. Take care of yourself, and I'll see you in the next video.